السلام عليكم. أعزائنا الطلبة. Today our lecture is about abdominal pain in childhood. We're going to know the causes of crying infant. Also, we're going to speak about colic and about the causes of abdominal pain during childhood. The time that normal children spend in crying is different between a child and other. In the majority of cases, it represents the baby's response for hunger and discomfort. So all that need is just reassurance for the parent and give them advice regarding and feeding, wrapping, and care. However, some babies cry for prolonged period. This will result in depression and anxiety and feeling of helplessness in a parent. Although in the majority of cases a crying baby represents a benign phenomenon, sometimes the complaint of the parent that the baby is crying all the time, it may represent a potential or actual non-accidental injury. We have to keep in mind that a significant cause for crying is identified in only minority of infants. However, if the child has sudden onset crying, it may be due to the infection, either urinary tract infection, meningitis, or otitis media. Sometimes it may result from an unrecognized fracture or esophagitis. And in a male patient, keep in mind a possibility of torsion of the testis. Also, severe nappy rash, constipation, and celiac disease, it may result in a miserable crying infant. A preterm infant who spend a lot of time at hospital, it may be difficult to settle. Also, patients who have chronic neurological disorders such as cerebral palsy also may have prolonged crying periods. Colic. Normal infant colic is often diagnosed according to the whistle rule of threes. It means that the infant should cry for more than 3 hours per day, at least 3 days per week, and for more than 3 weeks. However, the limitation of this definition include that first, there is lack of specificity of the word crying. Second, is that we have to wait 3 weeks in order to make the diagnosis of colic. A colic crying in infant is often described as paroxysmal and may be characterized by facial grimacing, flexion of the lower extremity, and passing flatus. Just less than 5% of all infants who have excessive crying, an organic etiology will be identified. However, the etiology of colic is unknown and it's likely to be multifactorial in etiology. And that means it is a diagnosis of exclusion. That's why, in order to make a diagnosis of a colic, we have to evaluate the infant in order to exclude other serious diagnoses. As we said that the differential diagnosis of colic is wide. It may include any condition that causes pain as well as an unpainful distress such as fatigue and sensory overload. Patients or infants who have reflux, gastroesophageal reflux, or maternal abuse of substance such as nicotine, also anomalous left coronary artery, all may cause a persistent crying. Sometimes a crying baby may reflect a disturb in the environment condition, also parental anxiety. However, in most cases, the cause of crying in infant will be unexplained. The condition will begin before 3 weeks corrected age, and usually the crying will have diurnal pattern that is more severe the afternoon and evening. The infant will be otherwise developing and thriving normally, and there is no organic cause is found. Management of the colic after we make sure that the infant is healthy and does not have a serious etiology of the crying. Then we start educating the family regarding the natural history and the benign nature of a colic. Learning about the temporal pattern of colic can be reassuring, which means that we have to tell the family that the crying will decrease at 6 weeks of age, and it will decrease by half by 12 week of age. Colic frequently resolve by 3 months. However, about 15% of infants with colic will continue to have crying after this age. Techniques that use for calming infants include the 5 S's, which include swaddling, soothing noises, and holding the infant in a side or stomach, swinging or slow rhythmic movement, and finally sucking on pacifier. It's very important to encourage the parent, especially unexperienced parent, to ask for the help of other family members in order to relieve their anxiety. Some medication that have been used in treatment of a colic, such as phenobarbital, diphenhydramine, simethicone, it all have been shown not to be of benefit, and some of them may cause serious side effects. That's why it is not recommended to be used. Although some studies have been suggested that probiotics may be helpful in colic, however, further research is required. Some herbal remedies, such as chamomile, licorice, and palm mint teas, have been used. However, it is not approved for use in infancy, as some of them may cause serious side effects like anemia and toxicity from hyponatremia. An appropriate feeding technique may be helpful, such as educating the parent regarding how to recognize a hunger cue and to avoid an excessive caffeine ingestion in the mother. Also, to avoid excessive bottle nipple flow. All this may be helpful in decreased colic. In the majority of cases, more specific dietary changes are not effective in reducing colic. Only in specific certain circumstances, such as an infant with diagnosed cow's milk protein allergy or intolerance. There are wide varieties of conditions that result in acute abdominal pain during childhood. This could be a non-specific causes or a medical condition, and some children have a surgical causes of acute abdominal pain. And about 50% of all children who's admitted to the hospital complaining from abdominal pain, the condition will be resolved without reaching a diagnosis. It is important to keep in mind that sometimes abdominal pain, the origin of it is outside the abdomen. For example, lower lobe pneumonia, it may cause pain that's referred to the abdomen. Also, primary peritonitis is seen in patients with ascites from nephrotic syndrome or liver disease, may cause abdominal pain. Patients who have DKA, diabetic ketoacidosis, also may have severe abdominal pain. Other children who is having abdominal pain may be result from urinary tract infection. So, as we said, this figure show the differential diagnosis or the causes of acute abdominal pain. So, the causes of acute abdominal pain, either it's arising from a condition outside the abdomen, like patients who have upper respiratory tract infection, lower lobe pneumonia, torsion of the testes, or some condition that's affecting hip and spine. Or the patient have an intra-abdominal origin of acute abdominal pain. In this condition, either the patient have medical causes or surgical causes. From surgical causes, acute appendicitis should be put at the top of the list. From the medical condition, just keep in mind that patient may have gastroenteritis or urinary tract anomaly, infection, or the patient may have diabetic ketoacidosis. That's why we have to take a urine sample from the patient and examine it for the presence of ketone or an infection.